Thank you for coming to see me this evening. How are you doing?
Good, and you?
I'm fine. My name is Kiera Page, and I'll be your counselor today during your intake process. I just wanted to let you know that I am a mandated reporter. So if you report anything or you say anything that'll cause immediate harm to yourself or to anyone around you, I will have to report that. But everything else is client confidential. Is that okay with you?
Sure.
Thank you. Let's get started. Can I have your first and last name?
Fernell Collins,
Okay. And for now, what is your date of birth?
July 26, 1993.
And how old are you?
27.
Oh, wow. That's good. Are you single, divorced, a widow?
Single.
Single? Okay. Are you dating?
Yes.
Okay. How long have you been dating?
Few months.
Okay. And how's that going for you?
It's going okay, I guess.
Okay. You sound unsure. Like I can hear it like in your voice or something. Why would you say you guess? Like is there something going on?
Because you just never know nowadays who people are. So
I can understand. So how would you rate your I guess your dating stage? Like would you rate it as good, bad, fair?
it's good at this point. It's good.
And how long have you guys known each other?
5 months.
Oh, okay. So in your like relationships or dating phases that you have, do you like being the dominant one, submissive, or how would they go for you?
I'm not just going to submit to anybody.
Mhm.
I'm naturally a dominant person in my personal life. But when it comes to being in a relationship, whenever that person comes, I'm going to be submissive to that person because they're going to be the head over my family. But again, in my personal life, I'm a dominant.
So you can define yourself as very independent.
Yes.
Okay. Have you ever been married before?
Nope.
Okay. Do you have any brothers and sisters?
Yes, I have 8 brothers and 2 sisters.
Oh wow. Okay. Um, are these all by your mom or
Mom and dad.
okay. Cool. Do you live by yourself?
Me and my pup.
Okay. What kind of dog do you have?
I have a 13-pound Chihuahua mixed with Terrier and miniature Pinscher.
Okay. And how old is he?
He's 2 years old.
What's the highest level of your education that you completed?
Master's degree.
Good. What do you have your master's in?
Social work.
How's that going for you being are you in the social work field currently?
Yes, and I'm currently studying law so I can pursue becoming a child advocate lawyer.
Oh, tell me a little bit about that.
I just want to be a lawyer. Social work is not something that's for me. It's just something that I needed to go through to get to my ultimate goal.
Okay. Are you currently enrolled in school now?
No, I'm not.
Okay. So when do you think you're gonna pursue
Fall
that law degree?
to be in law school.
Okay. Have you ever been in the military?
Nope.
No military, okay. Are you currently receiving any psychiatric services or professional counseling?
I do see a therapist.
How often do you see your therapist?
Usually every 2 weeks, but it hasn't been so frequent lately.
Okay. Is your therapist like, is it someone that you can relate to? Like,
Yes, I can relate to her. She's a Black woman.
did you find it easy, like opening it up to your therapist at first?
No, it was not. I don't like talking to people.
Okay. Have you ever had psychotherapy?
No.
Okay. Are you currently taking any prescribed psychiatric medication, antidepressants, or anything of that nature?
No, I am not.
Do you have a primary physician?
Yes.
And what's your doctor's name?
Dr. Amanda Harris.
Are they located in Huntsville?
Yes, Tennessee Valley.
Okay. When was the last time you had a physical?
July 25th of this year.
Okay. Do you see a specialist,
For
like just a healthcare specialist?
I don't see a specialist, but I do see another doctor with Tennessee Valley OBGYN for PCOS.
Okay. And what exactly is PCOS?
Polycystic ovary syndrome.
Okay. Do you currently use alcohol?
Do I currently what?
Use alcohol.
I drink wine.
Okay. How many times a day do you drink wine? Or like, how often do you use it?
Maybe 2 or 3 times a week.
Do you have a favorite type of wine?
Moscato.
Do you use tobacco?
No.
Have you ever used it before?
Yes.
Okay. So when you used to use tobacco, how often did you use it?
Maybe 2 or 3 times a week.
And what did tobacco do for you? Like, was it something that you used to like calm your nerves, just relaxed you, or?
To calm myself down and relax me.
Have you ever felt you have to cut down on your drinking or your drug usage when you use tobacco?
No.
Okay.
I didn't use it that often for me to do that.
So have you never had people like annoy you or criticize you for trying, like just even using the tobacco or drinking?
Yes, but again, they're not. Yes, but that's none of their business.
Mhm. So have you ever like used it before to where you did it like as a guilty pleasure?
No.
So, do you have problems with your sleeping habits?
Can you elaborate?
Like, are you sleeping too little, too much? Like, do you get a
I
lot of
sleep too
sleep?
much because of my new work hours.
Okay. What are your new work hours?
5 a.m. to 1 p.m.
Okay. Do you exercise?
Yes,
And how long do you exercise?
for an hour.
Okay, is it every day of the week?
No,
Okay. Do you have trouble or difficulty with like your appetite or anything like that?
not trouble, but sometimes I don't be hungry.
So you lose your appetite?
Yes,
Okay. Have you experienced like a significant weight loss like anytime this year or weight gain
no,
or anything?
no.
Okay. In a typical month, how often do you have four or more drinks in a 24-hour period?
One,
How often do you engage in recreational drug usage?
none,
And you don't smoke cigarettes or other tobacco products, right?
no,
Have you had any recent suicidal thoughts?
no.
Okay. Have you ever had them in the past?
Yes,
Okay, you said you're not currently in a relationship. In the last year, have you experienced any significant life changes or stressors?
yes.
Okay, and what was that?
I left my job with DHR and I got laid off from my next job after that, and I was unemployed for 3 to 4 months.
Have you still, well, since the pandemic, like if you found another job or anything, have you still been working, like besides being laid off?
I recently just found a new job.
Okay.
I've been there for a month.
Okay. All right, so I'm going to ask you, have you experienced any of these? You can just say yes or no. Extreme depressed moods,
Yes,
dramatic mood swings,
yes,
rapid speech,
no,
extreme anxiety,
yes,
panic attacks,
yes,
phobias,
yes,
sleep disturbances,
no,
hallucinations,
no,
unexplained losses of time,
no,
unexplained memory lapses,
no,
alcohol substance abuse,
no,
frequent body complaints,
no,
any eating disorders,
no,
body image problems,
no,
repetitive thoughts,
no,
repetitive behaviors,
no,
homicidal thoughts,
no,
and suicidal attempts.
no,
Okay. And you said you are currently employed, correct?
yes.
All right. And what is your current position?
I'm a substance abuse therapist.
And how do you like that?
It's okay for the most part.
Okay. And what's the name of your job?
Huntsville Recovery.
Okay. And are you happy with the current position?
Yes, I am.
Okay. Do you have any work-related stressors?
No.
Okay. Do you consider yourself to be religious?
Sure.
What is your faith?
I'm Christian.
And do you consider yourself to be spiritual?
Sure.
Okay. Now we're going to go into the part about talking about your family mental health history. You can just say yes or no to these as well. Depression,
Yes.
bipolar disorder,
No.
anxiety disorder,
Yes.
panic attacks,
Yes.
alcohol, substance abuse,
Yes.
schizophrenia,
No.
eating disorders,
No.
learning disabilities,
Yes.
trauma history,
What?
trauma history, like any
Yes.
traumatic, suicidal attempts,
No.
chronic illness.
No.
Okay. What do you consider to be your strength?
I'm a team player. I'm outspoken, hard worker, resilient. I can go on.
Okay. What do you like most about yourself?
I'm a forgiving person.
Do you think that affects, like, when you're always forgiving people, does that have an effect on your life or like anything?
Yes.
Okay. Do you think forgiving people can also be a weakness as well?
Yes.
What are some effective coping strategies that you've learned?
Some coping skills.
That you learned.
Oh, there's so many. I've had to do breathing techniques. I've had to do counting techniques. I've had to learn to actually do things that I like to do and not what others like.
Mm-hmm.
Yes, it's too many to list.
Okay. The coping skills that you learned, did you learn those through therapy?
Through therapy and on my own.
Okay. What are some of your goals for therapy?
To be able to not stress about other people's issues and dysfunctions.
Do you have like any goals for yourself overall?
To become a better person.
Okay. Do you have any kids?
No.
Okay. Do you want any?
5.
Okay. So do you plan on staying in Alabama long?
I don't know.
Where are you going to go to law school at?
I'm thinking Birmingham School of Law, but I don't know.
Okay. Have you looked into it already? Like, was it a good school, the reason why you were looking at it?
Yes.
Mm. Well, do you have any questions for me?
No, ma'am.
All right, well, thank you for the intake session today, and I will be in contact with you.
Thank you.